Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Yeah, this is an interesting. I thought this was an interesting article to us to start off with because we're always talking about exercise and how good it is for you. And this is interesting because it talks about the other side of it in terms of how can you go beyond what is good for you and make it bad, and when is exercise not so good for you. And so it's a different kind of article. Of course, it starts off by emphasizing how important it is for us to do the minimum requirement of exercises. And it is alarming to see that only 24% are actually meeting the minimum requirements. I'm not sure how many doctors talk to their patients about the importance of exercise. But it's something that should be discussed with your patients all the time. However, I guess this is talked about people who are diabetics and who exercise more than they should, and how that can be a problem. It's just as we know that, remember how Kevin talked to us early days about how his dad died during the exercise. And so there are a number of people who die during exercise. So it's important when you're talking about exercise, remember the minimum requirements do not take you to extreme exercise, takes you to the minimum requirements and what you should be doing. But there are some people who take it a little bit farther, and over exercises can drop dead, and that's what has happened to a number of people, especially if they didn't realize that they had coronary artery disease in the first place.
I'm glad
go ahead, Betty.
I was saying, I'm glad my husband is not listening to hear somebody that may have dropped dead, because he definitely does not want to exercise, period. And if he heard that, that would be another argument against it. So
well,
I'm glad he's not listening today.
Well, it wouldn't make a difference. If he's not going to exercise, he wouldn't exercise anyway.
Yeah.
That's true.
Yeah. But it's true. I mean, I remember my my chief resident, he died exercising as well. A number of people have died exercising. But we're talking about going to extremes.
Yeah.
And if you're only exercising 150 minutes a week, that's not going to be a high intensity exercise. I think when you go up to maybe 500 to 700 minutes per week, then you're talking about the higher range. It's a good idea to know what your heart rate is, and if you track your heart rate, you want to stay between 90 and 150. Yeah. So,
Dr. Callender, I just made a connection. I read an article this week about the young lady who qualified for the Olympics. She's a swimmer and African American, one of the first to qualify for the Olympics. And reading her story, at one point she had that syndrome of over exercising. She exercised so much that it was a health issue. She had to stop exercising, and I think it was over a period of months. then she was able to come back to her routine. But some, the Olympic athletes,
Yeah.
their training is so rigorous, and they want to succeed so much that they do anything that the coach tells them to do.
Yeah.
And so.
Right. So, it's interesting how balance is so important in life. And that's true about exercise as well. So,
Ah.
this is an article that we had talked about Alzheimer's and talked about the medications that actually remove the Alzheimer's toxin from the brain, and how there was a lot of controversy over whether this medication was going to really make things any different with Alzheimer's. One thing we know is that the dementia, in which Alzheimer's is one of the common manifestations, is associated with this amyloid B protein. And most of the medications that we have so far do not remove this protein. This medication that they're talking about removes the protein. The problem is that all patients with Alzheimer's do not always have excess amyloid deposits. And so the question is, will this medication turn out to be something that's really going to work, or is it going to be as useless as some of the others are? So we will soon see, but the thing about this medication that makes it different is that this medication actually removes the amyloid protein that is supposed to be causing the damage to the brain that is classified as Alzheimer's. Any comments or questions about this? Because we all have friends or acquaintances who have Alzheimer's.
Right.
That's true.
And so,
Dr. Callender, they're finding that all people that have Alzheimer's do not have the amyloid plaque buildup. And then a lot of people that don't have Alzheimer's do have amyloid plaque.
right. Mm-hmm. Right. So the only way we'll know is seeing how this new drug that has been approved will work out. So
the other question for me, Dr. Callender, is whether the Alzheimer's is brought on by heredity, and whether that affects.
We know that it is associated with heredity.
Yeah, but I'm talking about as far as these proteins from increasing. Is that natural or heredity?
Well, we think it's both. We think it is related to. Well, we know that Alzheimer's is genetic in the sense that it is in more families that have Alzheimer's. They have it. Now, your question is how much of it is not genetic and you still have Alzheimer's? I don't think we know the answer to any of it. We just know that there is a predisposition to it in families that already have Alzheimer's, but it occurs in families that don't have a genetic history. So,
Yeah, that answers my question.
Those are questions that we don't have the answer to.
Mm-hmm.
I heard someone say that some people have the amyloid or whatever you all said that don't have Alzheimer's. Do you think this medication would, if they took this medication, it would keep them from getting Alzheimer's?
I have no idea, and that's why there's a lot of controversy over them approving this medication. We don't know, so we're going to have the research, and actually we'll see what happens. There was a lot of discussion over the fact that they approved this medication, but we'll find out.
Okay.
Because the other medications don't help that much. uh, you never know.
It's also extremely expensive.
Yes, it is.
Yeah. Oh yeah, I remember you saying how expensive it was.
Right. Yeah.
Yeah.
Now,
Mr. Callender, how do they determine, besides verbal tests, that you have Alzheimer's? Is there a medical test you can take?
they have a MRI is one way. The other way is by mental cognitive testing. That probably is the best way. The cognitive testing. MRI is suggestive, and the cognitive tests are more definitive than the MRI. It's the two are put together. The test that identify your ability to use your brain and your memory, as well as the MRI. Those two together make for the diagnosis. Now, this is an unusual disease that we don't see as much in the United States, but 300,000, which is not a large number when you have 300 million Americans, but it's a significant number. And they call it a kissing bug because the parasite is transferred by a mosquito that goes in your eyes and carries this parasite. The mosquitoes carry a number of things, but this one in particular, and it becomes a concern because it is not a disease that is harmless. It's a disease that kills people, and it causes chronic illnesses as well. And so it's probably more likely to be associated in areas, as you can see here. Go back up a little. It identifies the areas that you have it. And Texas, Arizona, Arkansas, Louisiana, Mississippi, Tennessee, Utah, and California. The areas where you're likely to find it. It's not common around here, but anyway, those areas are common areas. And as you go down, it points out the diseases that occur as a consequence. Keep going down, and you show that you have heart disease, and you have sudden death, and you have it starts off with fever, body aches and headaches and all that, and then the heart, enlarged heart, cardiac arrest, and other GI complications. So while it only involves a small percentage of people, it's still a disease that causes heart disease and maybe fatal. So while this is not something that we see around here, it's something to be aware of anyway. Let's go to the next one, John, unless there's some questions about comments about it.
Yeah, well, I was about to say I was starting to talk, but I was muted. When I donate blood, this is one of the screening questions that would prevent me from being able to donate blood if I had any diagnosis of this Chagas disease. I'd never heard of it. You know, I filled out this form every time, a questionnaire before I can donate. Say, have you had Chagas? I said no, but I wouldn't even have known about it until I read this article. So thanks.
Okay. Go to the next one. This is interesting. We talked something about transgender students, and we talked about sex orientation and gender identity. Let me ask the question, what's the difference between gender and sexual identity, or is there a difference?
That's interesting.
Anybody want to take that on? Because I think it's
Is gender the sex you're born with, and sexual identity is a change of that sex?
any other thoughts about that before I tell you what it is?
I agree with the first part. Gender is the sex that you're born with, whereas the identity is the sex that you would like to be
Like to be.
associated with.
Yeah.
I think you know, the physical aspect is your sex, and the mental aspect is your gender.
That's exactly right. In other words, whether you have a chromosome XX or XY, and whether you have your genitalia that are consistent with that, with the XY being the penis and the XX being the uterus and the womb and the cervix, I mean the vagina. That's your sex identity. But the gender is what you consider yourself as. And so a transgender person would be someone who's born with sexual organs of let's say a male, but wants to be a female. And so the gender would be female, the sex would be either male or female, depending upon whether they have XX chromosome, which is female, or XY, which is male.
Dr. Callender, do they change their sex organs when they become transgender?
Some do, yes. They have operations that allow you to take out the genitalia. They don't often take out the ovaries, or because they use medications to take care of that. But they will often get genitalia that are consistent with the gender that they want to be. So that they are transformative sexual operations that, and this is where there's a lot of debate and discussion, because you can get these operations after the age of, anybody know?
15, I think, right?
Wish it
16.
were 15.
Oh.
12.
Oh,
12. But remember, that's the age of confirmation. That's when you can decide whether you want to become a Christian or not, or whatever. So they've used that age. That's kind of young from my perspective, but that's the same age that you were allowed to get treated for sexual diseases without your parents' permission.
oh,
And so they are, in many sense, they are consistent.
and they can
you-
do the surgery without the parents' permission?
Yes.
Oh,
Wow.
Now, just like, for example, this was in the news because of Dwayne Wade's son
Right.
who is changing his gender to become female, and they gave permission, although theoretically after the age of 12 you can, but many parents may not be willing to allow that to happen at the early age of 12.
I had a question, Doc. Why do you think there's so much resistance to this, or negative? I mean, it's almost like hate, toward these individuals.
I don't know, but it's certainly clear that people have killed, and one of the reasons they allege is that they thought that this person's gender was what they, in other words, you have a man dressed up, a man with a penis who's dressed up as a woman and who is acting like a woman. And because of that, males may be attracted to that person. And then when they find out that they've had some kind of sexual interaction with somebody who's a man, they then become hostile.
Yeah,
And they take it out on that person.
right.
And whether that's a small part of it or a large part of it, I don't know. But the hostility and hate is evident. There was a recent case where somebody shot a man, killed a man who was a transgender.
I might be able to understand that on a personal basis, but I'm talking about legislation where, you know, government leaders want to try to, I just don't understand where the negativity is coming from. Why do they want to control this?
Well, but I don't understand. They want to control everything anyway. So what's new? But anyway, but you're right. That is something that is, what is mysterious also is, you know, and recently one of the football players came out as gay.
Oh, yeah, yeah.
And to me, your sexual orientation or who you have sex with is your business. But it is now newsworthy when you come out as whatever you come out as your gender preference. And one of the comments was that hopefully one day this will not be newsworthy, because in other words, your sexual orientation or your who you go to bed with is your business. But anyway.
Dr. Callender, I'm guilty of this. When I was teaching, I had a young man. The other teachers allowed him to wear a dress to class, and I didn't. The main reason was that it just created havoc. And then when he came to the classroom dressed as a drag queen with all this makeup on and everything, it was disruptive in the classroom. And then he put on these feminine
Yeah.
weight, act more feminine than the other ones. And he even told the principal told me that I had to allow him in the classroom with a dress and dressed as a drag queen. And I just said I couldn't, because disruptive. And if we had sectional rehearsals or anything like that, it was just created havoc. I had no charge of the classroom. Then I know of another incident where a musician that was he was teaching in the public schools in Prince George's, and he came out. He was married, but he wanted to he was transgender, wear dresses and etc. And he was playing for one of the predominant churches. And as soon as even though their minister of music, we all knew what he was gay. But as soon as he wore a dress to church, they fired him immediately because of the appearance of it. And to me, thinking about my own viewpoints and etc., it is very hard to take that in our society, even though they say it is accepted, they got the rights and everything like that. But if you think about it, and I told this young man that he would have a hard time in life, because the way our society, we say we accept it and our government is in on it, but we really don't, in the back of our minds, it's okay as long as it's not in our family, it's right up in our face and creating havoc. Because how does a congregation accept a male who they know is a male, who's been dressing like a male, come up to the piano or organ bench dressed as a female?
Well, this is a new day, and we talked a couple of weeks ago about the difference between the Bible and the legal aspects. And we know in Acts, no, it's Romans, it talks about how that the Bible's perspective about it. But the legal perspective is different. And so the question is, how do you reconcile them? And that's one of the issues. The legal perspective is clear, that they have the same rights as everybody else, and they have the right to go to the restroom of their choice. And so how do we reconcile that? That's a good question. We just
Well,
know
like
that.
this young man was caught in the hallway having sex with another young man
Oh, my
who
God.
was in special ed.
Oh,
Now,
Mhm.
regular rules say that if you were caught having sex, because they got cameras all over the place, that you're suspended. But they couldn't suspend the special ed because they got certain rules to protect special education students saying that they don't know what they're doing. So these rules, they're not equal. They get some more rights than others. And to me, it's just hard to understand or comprehend because we're bending the rules like going to the restroom. We have enough problems because they can't put cameras in the bathrooms, and in high school they do everything, they smoke it and everything else, and they're also having sex in there. So if you put a transgender, how do you know he's transgender or
right.
he's straight going in the girl's bathroom? They got to wear a sign, I'm transgender, so I can go in this girl's bathroom.
Well, that's why they are, for the most part, they're doing away with gender-specific bathrooms.
There's another issue that I don't think we discussed a lot, which is in sports athletics.
Oh, yeah.
When a male with their muscularity and all this,
Right. Yeah, we discussed that last week.
right,
It's
decides to be a female, well, they
Right.
have an unfair advantage over some
Yeah.
females.
Yeah, that's right. That's why they do testosterone levels and estrogen levels. And in spite of that, there still is a lot of debate and discussion over the transgender role in athletics, just as you pointed out. And it's an issue that is still controversial, but the law is in favor of supporting transgender as the LGBTQ issue makes it something that becomes controversial. And I think the churches have not, some churches have accepted the homosexuality issue more than they've accepted the transgender issue. And that's what Carol is talking about. Because most churches nowadays have a number of homosexual people who are in high positions in the church, but they don't have many who are transgender in the church that they have accepted in high positions.
Wow.
Dr. Callender, I have a question regarding transplants. So does it matter if a male who may need, let's say, a liver transplant can accept a liver from a female?
No, doesn't matter.
Oh.
So in transplant, gender is irrelevant. And now the question is, we've been doing transplants now for since 1960s. And so we're talking about 60 years. And so that issue has not become one of any significance. Whether the donor is male or female seems to be
Dr.
irrelevant.
Callender, my husband received a kidney of a white woman and it worked.
Right. So, well, this is good news that COVID deaths in the nation fell below 300 for the last 7 days, which is a great sign. And but the fact is that it's still higher than we'd like it to be, and it looks like we're not going to be able to get to the 70% figure by July the 4th as we had hoped. But it would be nice if we could get more Americans fully vaccinated. But the resistance and reluctance remains one of our biggest issues.
Are they offering any money to people in the Maryland, DC area to get vaccinations?
I think
It depends. Different states have different offerings.
Well,
So
I'm speaking about the District of Columbia in Maryland.
I don't know about the District of Columbia has not yet, although the issue still remains a big problem in the district. I thought there were areas in Maryland where they were giving scholarships and monies to encourage it, but not in the district. It would seem to me that since it has worked, that it might be an attractive thing to do to get people to do the right thing. Since money works as a stimulus.
Mhm.
Over the last weekend, they were offering some incentives, some monetary incentives in the district at some locations.
Good.
I think in Maryland, they've been doing it for several weeks with a big drawing or reward of some sort.
Right.
By 4th of July, 40,000 or something, a winner.
Yeah, that's great. Well, this is interesting that in southern China, they had a new COVID outbreak, and the mystery of where COVID came from still remains an enigma, still unclear. But the fact that they had 20 new coronavirus cases is something to be concerned about, but nothing like how bad it has been in the past. It's interesting how the world has become a much smaller place, hasn't it?
Yeah.
Now, it's interesting that Fauci is talking about the fact that where vaccination rates lag, that's where the variant becomes more prevalent. And so becomes even more important for everybody to be vaccinated if it's possible, because then the variant is not as effective. The problem is that this variant is more infectious than the other variants. And so that makes it more likely to be transmissible. And that's what, yeah.
Dr. Callender, they also mentioned that the states where it's more prevalent are the red states.
Yeah.
Yeah,
I guess we're not surprised, are we?
Right.
I won't be vacationing in Mississippi, that's for sure.
It is kind of, yeah, I was talking, as of Friday, at many of the hospitals in District and Maryland, the staff will be required to be vaccinated.
Oh.
And which means if you don't get vaccinated, you'll either be suspended or terminated. And so this is interesting. Interesting, because the concern is that if you have a hospital where people are not vaccinated, then you have the potential of going to the hospital and catching the coronavirus.
Yeah.
So they are going to, so at Howard, it's going to be June the 25th. So some places it's July, but over the next couple of weeks, virtually all hospitals are going to require that you have vaccinations if you're working at the hospital.
Very good.
Now, as I mentioned last time, 95% of the doctors are vaccinated, but only 53% of the staff are vaccinated. So got a long way to go for the staff.
Dr. Callender, where my sister lives, state of Washington, they have reached their 70% threshold.
Oh, that's nice.
Great. And that's one of the areas where it was hardest hit initially.
Yeah.
Right.
Okay, next one. Yeah, this is an article that talks about the variant of mutation that makes it more infectious. It's becoming common all over the world.
Can you scroll down, John? I wanted to see the name of that doctor again. Scroll up, rather. Yeah. Yeah. Jamhandikar.
Yeah, you said it very well.
I think that was just a reporter. I don't think that was a doctor.
And then there's another name up there too. That one was much easier to pronounce, I think.
The concern is the greater transmissibility of this variant, which means if you're not vaccinated, it's easier to catch it. You know, I had a relative of mine who was in her 80s who refused to be vaccinated. And she just died of COVID.
Oh,
Oh, my
no.
goodness.
That's
Yeah, so that
bad.
there's a lot of people around who are older who refuse to be vaccinated, and they are good candidates to die from the virus. Especially when you're a grandparent and you have younger grandchildren who are not vaccinated as either, which was the situation in her case.
Mm. Caught it from the grandchildren? Oh my goodness.
Well, that's not uncommon if you're not vaccinated. So
Yeah, that's why Janice says she's being very careful.
this is a good question. Which is the best vaccine? Which is the best vaccine? What's the answer?
Pfizer.
The one that's available.
I think that's a good answer. The one that's available. That's right. Yeah. Because so far most of the vaccines are 75 to 95% effective. So all of them work that have been approved so far anyway.
The Johnson and Johnson vaccine, which you need one dose of supposedly, means that you might have another dose, a booster dose in the future, where the ones that need two doses, so that's a total of 3 doses if you're counting the booster for some shots and only 2 for the Johnson and Johnson.
Well, you know, it's interesting because they showed that after they looked at the phase 4, which is where we are now, that almost most of the vaccines were very efficient in terms of preventing the virus. There's also article that talks about the fact that there's no disadvantage to mixing up the vaccines. And that's what this says. That, and then other studies that have demonstrated that you can have one Moderna and one Pfizer and still have a good result, and maybe even have a better one. But it's clear though that the best vaccine is the vaccine you can get. Yeah. And the more people that are vaccinated, the better. This is an article that talks about COVID vaccine requirements and how people are requiring that their workers are vaccinated, and they need to have proof that they have been vaccinated. And this is an issue for many who feel their rights are being taken away from them because they aren't allowed to work if they're not vaccinated. And there's some people who just refuse to be vaccinated. This is an issue that's going to complicate matters.
Yeah.
But it's clear that it's the kind of thing that is important. Because if you've been vaccinated and you want to go to a place, working place, you want to work in a place where others have been vaccinated preferentially. And you almost feel it's your right to know if your other employees are vaccinated or not.
Dr. Callender, and then also, supposedly you can add the legal ramifications in the picture too, because what's going to happen is if the hospital staff workers refuse to get vaccinated, which means they could possibly put the patients at risk for
Right.
catching, then the patient could sue the hospital and then the hospital become at risk.
Well, of course, the hospitals will fire the patient, those employees who refuse to be vaccinated.
But there's
Which-
always going to be a test case.
Well, the test case has already been there. They threw it out of court. So, but you're right in the sense that that's at the lower court. So they're going to keep going to the higher courts until they get to the Supreme Court, I guess. But right now, if they don't agree to be vaccinated, they'll be suspended first and then terminated. It's an article that's playing games in many ways because they roll out a digital vaccine verification, but don't call it a passport because many of the congressmen said that that was illegal. And so this then addresses some of the concern that people have had about the vaccine passport.
It's really interesting, though, to me, the hypocrisy in the whole thing, because people are required to get driver's licenses, they're required to get passports when they travel, they're required to get all kinds of things for various situations. But this, in my opinion, this whole thing with the vaccine has been fueled by politics and fake news and primarily. I don't remember in my lifetime, which is considerably long, any other outcry about any kinds of vaccinations and whatever. I mean, to this degree, people have been anti-vaxxers with measles and the MMR and what have you, but not to this degree. I don't think. I mean, this is just weird.
I definitely agree with that. It's been politicized and tried to use as a political weapon, and it's really a bad thing. I mean, just what we just said about the states that voted Republican have lower vaccination rates.
Right.
It's a really bad thing. It's really bad.
The other thing that would not surprise me if sometime in the future they have a line item on your passport that states whether you have been vaccinated or not.
Well, anything that's digital opens itself up for hacking. So anybody can get in and make their own passport. So it would really have to be controlled. And just like the Russian cyber terrorists, can get in and cause all kind of havoc with anything that's digital. You can get to it.
Is that true for? I guess it's true for. I know it's true for green cards, But what about driver's licenses?
If they can get into the Pentagon's security system, their computer systems, they can get into anything. And they've gotten into them, they've hacked
Oh
them.
my
So
goodness. Terrible.
That's what everybody believes. I think that makes sense.
Yeah.
I'm just saying, why are we so surprised? Have we ever had a president like Trump before? We probably
No.
had one similar. So anything, he has definitely divided our country again. Our country has been divided for so long, so we're divided again. And Congress, if the Democrats want DC to become a state, you know the Republicans are going to say no. If you listen to the
Yeah.
reports, if the Democrats say down, the Republicans going to say up. If the Democrats going to say up, then the Republicans say down. So
Right.
we're definitely in a cold war right now in the United States,
mhm.
and it's affecting our health, our taxes, everything. And they're divided along the lines, even though they're in the minority, but they know it's enough to break it. And DC could become a state if they said that one of their votes would be Republican and the other one be Democrat. Let us in.
Well, this is an article that reflects that it's almost 40 years since the first case of HIV.
Yeah.
And of course, Fauci has been associated with HIV and now with COVID. So he's in a great position. And it was amazing to see how that situation was resolved. Now we have people who can be on medication for the rest of their lives and survive AIDS. And of course, the fact that it now is more common and much more common in men who have sex with men than all other causes of HIV is very interesting. Come a long way in many ways.
Yeah. And at that time, Dr. Callender, I remember very vividly in 81, I was working in MICU. All these young men were dying. And so Dr. Adams, ordered us to wear all these, things because they didn't know it was HIV. And the white people were spreading that it was coming from Africa. After they said that this was HIV. Oh my God, that was horrible.
Yeah, they all died then. That's right.
Yeah, they were saying that it came from Africa. Oh.
Right, came from the primate model, from the Eden apes with the virus, which was then rapidly transmitted. This is one of the early examples of zoonosis, which is where you get an infection from another species, and this then caused fear and to all, and finally it was identified that it was more common in men who had sex with men, and then the drug paraphernalia, and then finally identifying the virus, then getting the medications that were effective, and now we got to the point where HIV is not a sentence for death, but it's a disease that can be arrested. And we have people who live 30 and 40 years with HIV. So we've come a long way. It's an amazing way in which things have opened up, although the problem of men who have sex with men is still the number one problem. But and Blacks and Latino Hispanics are still the number one, number two sources for it. And one of the most frightening aspects of it is when you have a male who has sex with men who gives the virus to his wife or his girlfriend. And,
Yeah.
that is one of the most saddest cases
Yeah.
that we've had to deal with, women dying because the men were spreading the virus to the women. which is not dissimilar to what happens with the papillomavirus, which is why it's recommended that all children in school get vaccinated against the papillomavirus, because that's exactly what's happened and why women were dying of cervical cancer, because they were getting the papillomavirus from men. And it's interesting, initially they were only recommending that the women be vaccinated, when in point of fact, the source was from the men. But anyway, that's an interesting aside. But we've had a lot to learn. We've made a lot of mistakes, and hopefully we should learn from every single one of them.
Dr. Callender, you asked us a question last week about what the percentage of HIV has gone down, and I think you said 73%. And that is because, I don't know if we brought it up last week, but one of the reasons it may be going down is the lifestyle choices have been more responsible. But on the other hand, I'm seeing all these commercials on TV when they advertise the HIV drugs, and they have men on there holding hands and kissing each other on these commercials. So that's, almost counterproductive.
Well, the real reason for it going down is the medications, and the group that it hasn't affected as much is the men having sex with men. But I'm not sure that the sexual practices have changed. I'm sure that the medications have made a big difference, and having the varied combination of medications that can effectively eliminate or reduce the virus to levels that you can't be contagious is one of the major reasons. Taking the medication has come a long way.
Yeah, Doc, one of the commercials that Tatum was talking about, which I didn't know what it was until reading this article, was the PrEP. And, I see that it's pre-exposure prophylaxis. So if you're in a relationship like that with a partner that has HIV, you can take this and you won't get it. It'll prevent you from getting it,
Right. And so that it makes it makes you wonder why in the category of men who have sex with men, why it hasn't been more effective in that group as well. Because this is a daily pill strategy that works in all groups. But if somebody doesn't even know they have HIV and they don't get tested for it, then it can't be effective because you don't know you have it. And if you don't know you have it and you're having sex with other men, then you're spreading it. So the most dangerous group of men who have sex with men is those who are not tested and don't know whether or not they have HIV or not. This is an article that talks about the origin of COVID and the many who feel that we'll never know. Some feel we already know, but and then many think that the virus came to the lab, and the lab then was leaked from the lab. And as you know, the Chinese are not forthcoming about anything. So it's going to be hard to really get the final answer unless the Chinese actually tell the truth. But I think in the long run we'll finally know, but
Yeah.
but it's going to be difficult to prove anything. And it's unlikely that when they go to China, they will get any help in getting the answer. They're not going to admit that it came from a lab, if it did or not.
Your girl Mary, Marjorie, what's her name?
Yeah, Taylor.
Taylor Green.
Yeah, she says that it's a bioweapon.
It is a bioweapon, but the question is it an intentional bioweapon?
Yeah, that's what she says. It's an intentional bioweapon that Fauci funded.
Oh,
Well, I think that and it's interesting because it is true that NIH funds research all over the world. So yeah, in a way of speaking, you can say that, yeah, Fauci gave him a grant. So it depends upon your perspective. Her perspective is what you said, and most of us would not accept that.
President Trump said it's China virus.
Right.
Well, it is a China virus.
It is?
There's little question about that.
Mm.
It is. The virus came from China, so there's no
Yeah.
question
Yeah.
about whether it's a China virus. The question is, how did it originate? Did it come from a bat cave or did it come from the laboratory? That's the only question.
Yeah.
It's clear it came from China. The question is, how did it come from China? Did it come from the bat cave? Did it come from the laboratory?
You know, my experience over at NIH, there's a ton of Chinese researchers on campus at NIH, a ton of them. I'd say maybe a quarter at least of all the scientists that I saw in labs were Chinese.
Mm-hmm.
And I would go into some of their offices and they would have the keyboards that didn't have the regular keys on it. They had Chinese figures on them. You know, so I couldn't fix their computers. I had to unplug their keyboard and put in a regular English keyboard. There's a bunch of Chinese researchers, scientists here in Bethesda.
Yeah, that's true.
Okay, well, I don't know what else you can say except that it's here. So we got to learn how to deal with it. But it also tells you what can happen with germ warfare. Scary.
Yeah, it is. Mm-hmm.
Now, this is an interesting article because this guy doesn't plan to be vaccinated. And he feels that those people who are vaccinated are treated differently, which is true. And he thinks that's not fair. Yeah, they restrict unvaccinated players. That's correct. And he thinks that's not the right way to do it. And there are those who have legitimate reasons for not being vaccinated could rightly have this concern. But since the majority of people should be vaccinated, this is something that they may have to learn to live with.
What type of people would not be vaccinated?
Religious people who have religious reasons for not being vaccinated, or some people who have allergies that prevent them from being able to take the vaccine.
Do you know of any specific religion?
I wonder about the
Christian Scientists.
Christian Scientists, and what's the other one?
Some Pentecostal missions, Pentecostals.
Jehovah Witness.
Jehovah's Witness might be in that category.
Yeah.
Right.
And Pentecostals, yeah.
Well, I know they don't allow transfusions, the Jehovah Witnesses, but
They accept transplants though.
yeah, and I think they I don't know. I don't know. I have to
Witchcraft believers and voodoo believers. They think that witchcraft doctor and the voodoo priest can take that out. I heard, I know some voodoo priests. Yeah.
Dr. Callender, what about transplant recipients who are on very high doses of immunosuppressive medicine, including those who recently got their transplants?
What's your question about them?
Would they be hesitant about giving them the COVID shot right away, or
No,
no?
wouldn't be hesitant. It's just that it's not likely to work well. And but that wouldn't mean they'd be hesitant to give it to them. It's just that it's not going to be as effective. And so we don't have the answer to the question is, will these people who have been recently transplanted need 3 shots rather than 2 shots, or 4 shots rather than 2 shots? And hopefully the research will give us the answer to that over the next 3 to 6 months.
How about the dialysis patients, Dr. Callender?
There's no evidence that, dialysis patients are immunosuppressed, but to what degree, I'm not sure. And while we have evidence about the transplant patients, I haven't seen any studies that demonstrate that that's the case with dialysis patients. So those studies remain to be done.
Oh.
But we know about the transplant patients. That's clear.
So, Dr. Callender, a professional athlete who refuses to get vaccinated and maybe is asymptomatic and comes in contact with other athletes who are fully vaccinated, but maybe they're one of the 5% that get it. And one of the NBA players, I know you heard about him, tested positive. He's fully vaccinated and cannot play in the championship. Chris Paul cannot participate now.
Well, he can. He's cleared. He's cleared to return now.
Oh, he did. He did.
Yeah, as of yesterday. But yeah, but you're right, and that's the issue, is that if you have been vaccinated, the breakthrough vaccinations occur in 3 out of 100. So yeah, but the difference is that the likelihood of getting the disease itself is very unlikely. Just like in his case, he had no symptoms. He turned positive but had no symptoms. So that's why he's able to come back and play for the next game.
Well, the golfer that just won the big tournament over the weekend was called out of a tournament a couple weeks before because he tested positive.
Right. He was he was leading, and that was tough break for him. We had a discussion last week about the anxiety about resuming pre-virus activities, and it was clear from that there was much anxiety about returning to normal, so to speak. And still there's a great fear that relaxing restrictions will increase virus, primarily because there's so many unvaccinated people. And you would think that this might increase the likelihood of people getting vaccinated, but
Right.
so far it hasn't.
Dr. Callender, I think we heard, I don't know if this is verified, but I think Dr. Walter might be able to help us. I heard there were 10,000 breakthrough cases in the US.
Right, right. That's about right. Yeah,
And,
and we've vaccinated what, about 300, about 150 million people.
right. So
70 million.
I'm trying to tell people, were there any deaths of those breakthrough
I
cases?
don't know. I can't answer that question. I believe there have been, but I don't know the answer.
I think it's a very small number, if so.
Yeah, but yeah, but I think there have been, but I don't know the number. So
Okay.
question is, what else can we do? 46% say they will definitely not get a vaccine.
Right.
I have young cousins who are part of that group, and it has frustrated me to no end. And these are, very intelligent young people,
Yeah.
highly, very high performers, but they won't get one, and
Yeah.
there's nothing you can do to make them change their mind. Um,
Yeah.
What's the rationale, Dar?
Well, they're saying that we don't know enough about the vaccine yet, and they're just trying to kill us like they did in Tuskegee. And I mean, these are educated, highly educated folks.
Yeah.
And it just, that mentality is just very pervasive. And I don't care what kind of data you present or what kind of arguments you present. They are just steadfast in their thoughts, and they're just not going to do it.
Yeah. I agree with you 100%. One of the chaplain who was working with me, he's 65. He said, Maya, I'm not getting the vaccine, and they're trying to kill all Black people and everything. And he has eye problems. He comes to the Harvard every week for that. So I don't think they'll let him back as a chaplain. And he said, I will not take it, he said. They're killing Black people. With people like that, I don't know what to say. And he said,
No.
did you take it? I said, yes, I did.
Well,
That's
my
all I can
cousin's
say.
grandmother died from COVID.
Wow.
I mean, and that's the thing that it just doesn't make sense. Any way you
No, it
slice it,
doesn't.
it just does not make sense.
No, it
I
doesn't.
have a situation where is my best girlfriend, who's a very intelligent person, educated woman. Her husband is elderly. He's 83. And all of last year, he was in the house. She went out for everything, medicine, food. He stayed in for months and months. Whatever you need, I'll get it. Don't. And he was afraid. He had
Yeah.
health issues and he was elderly. And several months ago, about 2 months ago, his doctor suggested, get your vaccination. You don't want COVID. It could, really take you down. So it might have been maybe 3 months ago. She made sure he got it. She took him for both shots. She still refuses to get it. Recently, we were at a social gathering and a large group of people, but we broke down into smaller groups. And of course, COVID is always a topic of conversation. And someone spoke about it and said, those who are not vaccinated, they're stupid, they're ignorant. What are they thinking about? And I noticed she left early. And the next day she called me and said that she was offended. I'm not stupid and I'm not ignorant. And I told her, but I said, you have to realize you're the minority. Majority of the people in our social setting and almost everywhere you go, we're vaccinated.
Yeah.
So the fact that you're saying that you're putting on your mask and gloves to protect yourself from us, no, we're protecting you. Everyone else is vaccinated. So you can't get through to her. I mean, it's a big
No,
argument.
you can't.
You can't do it.
No. Mm-mm.
So,
Yeah.
I think it's really funny that
mhm.
people say that the vaccine is killing Black people.
I
You
know. They
You
say
know,
that.
if you're in the clinic where they're giving the shots, and they go in the back and get the black shot, black box just for black people. Vaccine.
Yeah, well,
That's crazy.
sad but true.
Yeah.
This is an interesting change of pace that Trump's controversial ex-doctor calls for Biden cognitive tests. And it's interesting that the cognitive tests will be, the results will be determined by whoever is the physician, and we can't expect them to tell us the truth. So just as he attested to Trump's excellent health while the president was obese and other things, it is expected that whoever does the physical will do the same thing.
The AMA needs to investigate his license.
I think so.
That is crazy, but he was Barack's medical advisor as well.
Oh,
Mhm.
That's unbelievable right there. I mean, how did that
yeah.
happen?
But he couldn't say anything about Barack other than he was healthy. I mean, just,
Right.
That's true. Yeah.
Yeah.
Look at him and tell he was.
Oh, Betty made it home safe. Hi, Betty.
Yes, thank you. I was trying to drive and listen, but I found myself looking down at my phone, so I cut it off.
Yeah.
Good, good. That's safe.
Yeah.
Yes,
That's
it
safe.
is. Yes, it is.
Yeah, okay. All right, let's get to the next one. Not much we can do about that.
Well, that's the last article.
Okay. I think that one of the things that is coming up recently for discussion is the fact that because so many of us have been reluctant to get our examinations, Black cancer awareness issue has surfaced again. We know that more people are dying from cardiovascular disease, but even more people are dying from cancer than before. And one of the reasons is because we're not getting our checkups like we used to, not getting our mammograms, not getting other things and colonoscopies. Of course, this group has been different because you have been, but outside that has been a concern, particularly in the Black and Latino Hispanic communities, cancer awareness. So that's something to think about.
Dr. Callender, I just found this article. It's called overtraining syndrome. Remember we talked about the first article, too much exercise?
Yeah.
Okay, I don't know if I could pull it up. Let's see.
What about it? Was there something about it that?
Well, it was the young lady who qualified for the Olympics. That's what she had. She was trying so hard that she had this syndrome and had had to stop training for a while to come back to normal.
Yeah. Well, and I guess that's why we talked about people dying while exercising, which is not, which is something that occurs. But anyway.
There are all kind of different aspects of it. Overtraining syndrome, fatigue, depression, bradycardia, loss of motivation. Those are the main symptoms. Anyway, I'll go ahead and stop.
Dr. Callender, back to the cancer piece. I noticed that they have reduced the recommendation for age for colonoscopies, especially in Black people,
Mhm.
because the incidence, of course, we take #1 slot there too, but
To 45, right?
mhm.
Yeah.
Yeah, because we're finding many more people who were under 50 who are coming up with colon cancer, and they recognize that 50 was too old, that 45 was better, although I'm not sure that's low enough. But anyway, it's a start.
Mhm.
I'm pleased that in this group, people are still getting colonoscopies. So yeah, which is good.
Dr. Callender, in general, the age requirements are lowering on just about everything.
Mhm.
For instance, the mammogram age came down as well, didn't it? Screen?
Yeah, well, you know, we far too frequently find younger women with breast cancer, so that well, you have people as young as 20 who have breast cancer, so that um, the uh, the fact that it's going down is not, especially in the African American population. So it's very sensible.
Yeah, we had one of our participants, Rochelle, is a breast cancer survivor, but she's not on today. I don't I don't know what happened to her today, but yeah, she's a breast cancer survivor. But she's not in that age bracket that you were talking about.
Well, one of the things that's overlooked also with breast cancer is men can also get breast cancer
Yeah. Yeah.
and are not checked for it or don't ask to be checked for it.
Right. Right.
Right, absolutely. And
Mhm.
as a matter of fact, John Robinson wrote a paper on breast cancer in males, and it's just not as obviously not as common, but it does occur.
Yeah,
Okay, well,
one other question. Yeah, that paper on Dr. John Robinson, I'm sure he mentioned the fact of how it would be, uh, embarrassing, but I guess safe for a man to go to a doctor and say that he would like to have a mammogram.
well, the first thing is you want to have your breasts examined,
Yeah.
and then of course after that, uh, because there's a condition called gynecomastia, in which men have breasts that are larger than normal, and so when you have breasts that are larger than normal, then and there are a number of diseases that can cause that. Then of course that's the reason for you to be examined by your physician first, and see if there are any masses, and then after that you can get a mammogram. But the first part of it is to get the breast examined by your physician. Yeah, and to
Dr.
be aware of the fact that breast cancers occur in men as well as in women, just not to the frequency. Yes,
Dr.
Chaplain?
Callender, I have one question for you. A lot of patients ask me because they say, why do I have to get referrals, when I go to the specialist? Because when I was hospitalized, they say I had a liver problem, and then it's been 3-4 months. So when I go to the doctor, they say you need a referral. Why do the doctors don't get paid if they don't get a referral, or what is it?
Yeah, it is required in order for you to see the doctor that you have a referral. This is part of the effort on the part of uh, family physicians to keep them from referring unnecessarily. And so as a consequence, if you don't get a referral, the doctor often will not see you uh, because of that requirement. So yes, that is correct.
Oh,
If you don't have a referral, then many practices you won't be able to see the doctor.
Dr. Kelly, I have a question about
mm.
the cost comparison between an office visit and a virtual visit.
What's your question?
What is the price difference?
I forget what it is, but it's it's a difference of, I forget, something like $25 difference.
Get rid of say it's
But
not
actually, gotta remember, there was no payment at all before. So even though it's less than the physical exam, it's still more than it was. So the virtual exam is, and then there's a desire for that to continue, for the payment for the virtual visit.
Yeah, so basically it sounds like it's about $25 cheaper.
Something like that. I can't remember the precise, but it's about that, yeah.
talking about referrals. There are some insurances that say no referral required when you.
That's correct.
What do you
There's
say?
some that don't require, but there are some that do, right?
Ah,
The other question I had, Dr. Callender, is some of these medicines that you you have to have in your hand when you want to get a prescription refill. But I noticed that there was a doctor that I had that was able to get a prescription filled without, I mean, by calling. So is there a difference between some doctors are allowed to do call-ins for certain medicines and others you have to take the prescription in hand to the pharmacist?
I don't know of any requirement that you have to have a prescription. Now, you have to have an interaction between the pharmacy and the physician. Sometimes that is a telephone call, sometimes it's prescription, sometimes it's required, they will require you to have a written
Got it.
communication, or they will send to the doctor the
Fax?
fax, and the doctor will then respond to the fax, and they will accept that. Sometimes they will accept that more often than they will accept the prescription.
Sometimes in narcotic drugs, though, you do have to
Oh.
take a prescription in person. They won't take-
right,
That's
right.
different, yeah, for narcotics.
Oh,
you
I'm
got-
sorry. I'm sorry. I meant to mention that. That's the one I'm talking about. Like,
Oh, for a narcotic, yeah.
Yeah.
Yeah,
if
yeah.
for narcotic like Oxycontin, my primary care physician would have to actually give me a physical
Mhm.
prescription to take,
Oh, yeah.
whereas my pain doctor was able to call it in.
Yeah, and he's a pain specialist, so,
Right.
yeah,
Right.
that's
Okay.
right.
Thank you for that.
Okay, well,
Carol, you on mute. Carol, you on mute.
I was wondering if you're going to shop around for doctors and to find a doctor that's suitable for you, your primary care is not going to refer you, or will they refer you to go and get the second opinion from somebody else? Because they, you want to shop around. Will, seem like
well, now what, I don't understand your question. What is your question?
doctors, you can't shop around for a doctor unless you got a
Right.
referral. So
No,
your
that's-
primary care doctor, he's gonna let you shop around. If you want to go to somebody else, he said, okay, I'll refer you to somebody else to shop around to see if I'm doing a good job.
Well, the referral is usually for a specialist. You can always get another primary care doctor.
But what if you don't
The referral is for a specialist.
Okay, if you
Not-
don't like your specialist, can you shop around for another specialist?
Yeah, you can, yes, you can. And once you get that referral, you can tell your primary care doctor who you want to go to,
Mhm.
and ask him for a referral.
The other thing, Dr. Callender, is that if your primary care physician refers you to somebody that's not convenient to your location, then the primary care physician can probably try to recommend someone else that's closer to your area of location.
Sure, they can.
when I do need to actually get a referral from my primary care for certain things, she will give me a list of people,
Mm.
list of doctors, and then I choose which one I want to go to.
Good doctor.
Yeah.
Good doctor. Yeah. Okay. See you guys next Thursday, God willing.
Amen.
Okay.
Amen.
Thank you, doctor.
Anything closing, Chaplain Thorpe, you want to share with us?
Well, you're a blessing to us, you do a lot and inform us about our health and give us good education on that. And I want to just thank you on behalf of everybody.
Thank you.
And
Yeah.
we wish you best health and everything for you and your family.
Good. Keep me in your prayers. Thank you so much. Appreciate it. And have a great
Will.
weekend.
Thank
Okay.
you.
Bye.
Take care.
Be
Bye-bye.
safe, everyone.
Bye.
Yes. Be safe.
Thank you. Thank you.